Earlier in the program, we reported on Congressman Paul Ryan's GOP budget proposal, which takes sharp aim at health care spending. Journalist Steven Brill spent 7 months putting U.S. hospital bills under the microscope to find out why health care, American style, costs so much. His findings are in the March 4th issue of Time magazine. Former Vermont Governor Howard Dean is a physician who, during his 6 terms in office, expanded his state's universal health care program and kept costs in check. Gentlemen, welcome. I look forward to this conversation. Steve, you spent 21,000 words. Longest article in Time's history. It was an amazing piece with some amazing reporting in it. But I'm going to ask you to boil those 21,000 words down to about 20 and tell me why you think, principally, American health care costs as much as it does.
I think I can boil it down into 4 words. The price is too high, and the reason the prices are too high is that there isn't a free marketplace. The typical healthcare consumer, whether it's a person who's uninsured or even the largest of the insurance companies, doesn't have the leverage in the marketplace. We live in a world where, we think this is a free market. We like everything to be a free market in this country, but there is no free market when you go to the emergency room. There is no free market when you have to buy a cancer drug, and I'm sure that Governor Dean will testify to that from his experience.
Governor Dean, let me ask you that question in a different sort of way. In so many industries, we see that costs trend down over time. We've certainly seen it in technology, where the price that we used to pay for a flat-screen TV or for a cell phone, those prices are a fraction of what they used to be. But not so in healthcare. Why is healthcare different?
In medicine, the more a facility you have to deliver, the more it has to be filled, and therefore the higher the price goes. The problem is that the fee-for-service system that we have encourages us to spend as much as we possibly can. We only get paid, I'm a physician, get paid when somebody's sick. We don't get paid to keep them well. And in order to fix this problem, you've got to completely do away with the current way of we pay providers and pay them by the patient, not by the procedure. And until that happens, it really doesn't matter what kind of supposed healthcare cost control you have, it's not going to work.
Mr. Brill, I'd like you to pick up on what the governor just said, but also address one of the things that I found fascinating in your article. A lot of the political conversation lately has been about raising the eligibility age for Medicare. You argue conversely that if we really wanted to reduce overall costs, though not the part the government pays, you would lower the eligibility age for Medicare. Explain why and what the effect you think would be.
Well, it actually reduced the cost that the government's going to pay under Obamacare, too. The reason is simple. The only efficient buyer of health care is Medicare. And if you moved more people into Medicare and away from either not having insurance or using the insurance companies that they have, they would be paying a premium to Medicare that would be much less, because Medicare's costs are a fraction of what everyone else is forced to pay. The reason being that Medicare alone has the market leverage to buy health care at a reasonable price. So it's not really a matter of moving people away from the fee-for-service. It's a matter of controlling the prices, and the way you do that is either you have a balanced market, which we don't have, or you have to intervene in some way in that market.
Governor, Steven keeps talking about market forces here. So let's talk a little bit about the market and the role that consumers, the American people, can play in all of this. Do you see that the healthcare industry is going to bring the consumer along, or are consumers going to be pushing for the changes, whether it's on price or any other innovation?
Well, first of all, I don't agree with Steve about putting people in Medicare. I do think it's a good idea to put people at a lower age into Medicare, because it is true that they are a lower cost provider and they're more efficient. The problem is their costs are out of control too. So again, you cannot, as long as you pay us to do procedures, we're going to do a lot of procedures, and that is the fundamental problem. So I think it's great if you put people over 55 into Medicare instead of 65. It's cheaper for the insurance companies. The government pays 4% instead of 20% overhead, but that is not going to be the ultimate solution. The ultimate solution is get away from fee-for-service medicine. It does not work because you simply pay us to do as much as we possibly can. And as long as you have a system that does that, it doesn't matter what kind of consumer pressure is on it. You want consumer pressure, they can buy insurance well, they can't buy health care well.
Well, but the fact is, though, you're talking about one aspect, what the doctors do. If you talk about the cost of drugs, the cost of durable medical equipment, the cost of so many other things, just the stay in the hospital room, you really have to get away from a situation where it's a seller's market and a seller's market only. So I think you have to do both, but I think you have to start by looking at the prices, which is what I did with this article. The simple fact is that we live in two economies in this country. All of us live in one economy, which has had a lot of trouble over the last half decade. And then there's the medical economy, which has been booming, just going hog wild booming. And the reason is there is no control on the profits and the prices. And I don't come at that, from, a left-wing perspective or anything else. I just look at it from the standpoint of the consumer, which is they have no leverage in that marketplace.
Gentlemen.
See, actually what will happen is, under Obamacare, there's actually some hope for this, because the accountable care organizations are going to be big enough to deliver health care at a unit price. I think the hospitals and the physicians all have to be paid by the patient. And if you don't do that, costs continue to go up.
All right, gentlemen, we alas have to leave it there. I'm not sure we solved it, but we made a valiant effort. I highly recommend Steve Brill's piece. It is one of the best things I've read on the healthcare cost spiral in this country in years. Thanks, Court TV founder and journalist Steve Brill and former Governor Howard Dean.